Welcome to this short training video based on the HEE assessment strategy, which is available on the HEE website. This video is about completing a reflective account. Written reflections are an essential part of documenting learning. They provide an opportunity for a trainee to reflect on how their practice, including how they provide patient care, has changed because of learning. They can also help identify possible solutions to meet a particular learning outcome. A reflective account is one of the assessment tools that can be used to document the assessment activities as part of the HEE assessment strategy. It can be used to describe the activity in practice and how this is mapped to the learning outcomes. The purpose of the reflective account is to provide an opportunity for a trainee to think and consider analytically about anything relating to their professional practice. It should be a brief written description of a trainee's experience and actions, including what went well and reflecting on what could be improved and how lessons learned will benefit the trainee's development, as well as patients and the public. A trainee may wish to focus on a particular set of learning outcomes, such as communication. Once a reflective account has been completed, this will allow a trainee to gain insight into their practice and use the lessons learned to maintain or make improvements where possible. A reflective account can be completed at any point during the year and can follow on from completing any of the assessment activities outlined in the HEE assessment strategy. The following example will help trainees plan a reflective account and what should be included. It's important to note that this form will be embedded into the e-portfolio and may differ slightly within the system. The first part should include a brief outline of the area of work. The setting of the trainee's practice and main roles should be included. The next section should explain the situation or activity undertaken and provide examples of the activity in detail. The final part should include what has been learnt, what would be done differently based on what has been learnt, and should link to the learning outcomes being claimed. For further information on the learning outcomes, please visit the HEE Training Pharmacist Foundation Year Assessment Guide and Strategy on the HEE website. This describes the assessment activities, which as a whole are designed to provide a range of evidence against each of the learning outcomes. There are also many other additional resources on the HEE website. For more information, particularly on the learning outcomes, please do look at the GPHC Foundation Training Manual on the GPHC website.